Hello, everybody, and welcome back to our How-To Corner. In today's episode, we're going to talk about growing strains. I'm Dr. Will Gray. Before we get started, please comment, share, subscribe, like, leave questions in your comments. We will definitely get back with you and help to try to solve some of your problems you may have. With that being said, let's get going. The agenda for today's episode is pretty simple. We're going to talk about what is a growing strain. We're going to talk about the anatomy that goes with a growing strain. We're also going to talk about how they happen, the signs and symptoms, types, as well as the diagnosis or how you diagnose the growing strain, as well as treatment in an early stage and recovery, as well as prevention. Now, let's get started with what is a groin strain. A groin strain is basically an injury of your adductor muscles located on the inner thigh. One of the particular muscles that can be included, or pretty much, how can I say this? The most problematic of those muscles, it will be your actual hip flexor. It's not necessarily considered an adductor muscle all the way, but it is an adductor muscle in a sense, but is one of the muscles that can basically simulate or have pain that's very similar to a groin strain. It happens when your muscles are overstretched or torn or basically overused or strained. And then the severe degrees range from grade 1 to 3. Now, let's talk about the anatomy of the growing strain. What muscles are involved? Your adductor longus, brevis magnus, gracilis, and pectineus. But also, the importance of these muscles to help with hip stability, change direction, not sprinting, not printing, but sprinting and kicking. Now, let's get to how growing strains happen. Usually happen when a subject changes direction. You have a situation where if you're a sprinter or you have an increase in acceleration all of a sudden, as well as forceful kicking, slipping, losing balance, trying to catch yourself, weak/tight growing muscles. Like I said, that hip flexor also, fatigue or improper warm up. Very, 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 very important to be able to um, describe or diagnose the difference between a hip flexor strain and a growing strain. They can kind of have a lot of overlap or present as such. Now, signs and symptoms. You usually have a sharp pain in the inner thigh, tenderness or swelling, bruising that ranges from moderate to severe cases. That's basically when you're torn the muscle is bleeding. Pain when squeezing your legs together. If you were to test it, you squeeze a pillow or a ball or put your hands between your knees and try to resist closing. And then difficulty running, cutting. Also, you have a reduced hip range of motion. Now, the types of growing strains, you just range from 1 all the way to 3. You have a minor overstretch with 1, mild pain is usually associated. You have a partial muscle tear with 2, swelling and loss of strength is usually associated. And then you have severe or complete tear, significant pain, bruising, limited mobility. Usually, when you have the last one, a surgical procedure is definitely needed. It requires you to recover from that procedure. It can take 4 to 6 months. It really depends on how recovery goes and what type of athlete are you. You a quick twitch athlete or a little bit less athletic, that will also determine your recovery time. Diagnosis. How do we diagnose? Basically, physical exam. We use an actual physical exam by not just an athletic trainer doctor, but also a physical therapist. There are just certain special tests you actually use. Physical examination by certain groups of um, healthcare clinicians or practitioners tends to be a little bit less accurate than others. So you have to find somebody who's actually experienced with sports injuries. Pain during resisted adduction is one of those tests, as well as range of motion tests to detect if you have a length discrepancy as far as like movement. And then MRI, ultrasound, severe cases. Only when you have a complete tear, and people know that they having to determine if this tear, where the tear is located, how severe the tear is it a bone, is it an avulsion, or what. Now, let's continue on. Treatment early stage, you have to make sure you rest and avoid cutting and any type of actual activity that can cause discomfort. You want to ice more than you heat because obviously a growing strain of this nature or a growing strain in general, you want to cool down as quick as possible to prevent bleeding. And then some people use compression wraps. That's pretty much a thing that can be here or there. Depends on how can I say this? Depends on the person, I guess. Elevation is only there to be able to help with circulation, nothing more, nothing less. Unless there's severe swelling that's there, and then you help with that. And then use of non-steroidal inflammatory medications would definitely be good. They usually are given to you by your doctor. They come in the form of Loxicam, um, for the most part. Sometimes they just give you over-the-counter Advil or ibuprofen, 800s or whatever. Recovery time ranges from 1 to 12 weeks, with 1 to 2 weeks meaning grade 1. Grade 2 is 3 to 6 weeks, and then grade 3 is 8 to 12 weeks. Sometimes surgeries follows with grade 3 because of the severity of it. Recovery depends on severity, conditioning level, as well as treatment consistency, as well as your genetics too. There's a little bit of a back and forth that we have to have in order to evolve or expand on that topic, right? About your genetics. Now, rehab, this is more of just a outline than an actual specific, breakdown. You have phase one. You want to reduce pain and improve mobility. Just basically helping with modalities, trying to decrease the pain that we don't have pain with normal movements. And then we progress to phase two, where we're trying to promote strengthening of said muscles so they can have some resiliency when you perform an activity, so they won't basically overstretch or tear again. And then phase three, return to play, and that requires a lot. That requires some ramping up of different activities, as well as introducing some activities that can simulate the end result in order to make sure that you're able to get back without any hiccups. Now, I know that was a kind of quick overview, but if you have any questions, concerns, or issues, thank you so much for making it to this part of the platform. Please contact us on all of our actual platforms listed, as well as like, comment, subscribe. Please share. And like I said, if you want to talk to us straight up, just get to us directly. You want to get to our website and use that particular URL right there you see in front of you, and just send us an actual question. We'll be definitely all for answering. With that being said, I hope you have a blessed one. Catch you next one.